Medical education, as a team, we provide medical education for postgrad and undergrad, so medical students and resident doctors. We provide that for NHSE, for the University of Sheffield and the University of Nottingham. And I guess within the MedEd team, there are lots and lots of different people that come in and out of our team. So there's consultants, there's clinical educators, there's simulation leads, higher trainees, service users and carers are also part of our co-production teams, and the admin team who hold it all together and keep us moving around in all of the programmes, both undergrad and postgrad.
We also run the Journal Club at the Case Conference, so that kind of weekly teaching we have on a Wednesday, which is not just for the doctors, that's for all of our AHP colleagues to join and for everyone to get their kind of CPD requirements in.
A large amount of our challenges often are related to the fact that people are not necessarily aware of that role that we play, and it isn't necessarily always on people's minds either, because in most people's minds the trust provides care clinically to patients, but there isn't necessarily that awareness of the background work that goes into making sure that that pipeline of clinicians, not just for the delivery of services currently, but also for the future delivery of services, is being managed, maintained and having their needs met as well. That means, for example, making sure that we plan the need for facilities for our learners, making sure that they're able to deliver the clinical work that they do, but also at the same time make sure that their training needs are met.
I guess there's three things that we would highlight as being the things that we're most proud of. For me, I think there's something about how we evaluate and get our feedback for all of the programmes that we run for undergrad and postgrad. And I find it amazing really that we're in that 90% of strongly agree or good, very good, like across the board. We're also very proud of having a space within medical education for people to be able to come in.
I've been so lucky, I think, to have been supported by everyone in the MedEd department to carve out this space alongside my clinical work to work in medical education. You know, as a result of the support of everyone in the department, I now facilitate SIM fairly regularly. I work for NHS England as a SIM fellow. I've got a master's in medical education, and because of kind of the support I've had from people like Kende and Ballo and Jonathan, I'm going to be able to carry on doing this throughout my kind of psychiatry career, and I just feel really privileged that I've been given the space to do that.
And I guess the third thing that I'd want to be proud of and highlight is that our co-production process for simulation, for co-producing simulated scenarios, which is fairly innovative. So we've got a whole process and a model of how we do that, and teams of service users and carers that have come in. So every simulation that we deliver has been co-produced, so we're very proud of that. So in terms of our future plans, they relate to our challenges in terms of the workforce plan. So we're looking at trying to secure some space in Mansfield to be able to deliver training and education. And I guess the other part around our future planning is to try and get a little bit more recognition around our co-production and the use of lived experience in terms of how we develop scenarios and simulation. And we know that nationally there's quite a lot going on within medical education and lived experience, and we're hoping that we can get more involved in that conversation. I think that within medical education, in fact I know, that everything's taught with kind of a core value of kindness and honesty and teamwork, which I know resonates with the trust value. But there's a real quality and depth of training which ultimately is going to be helpful for mental health services, and obviously it's going to be part of the services that the Trust provides in the future.
I also think that we're accredited to the Trust because we represent the Trust nationally, so we represent the Trust at conferences like DMEC and at ASPE with workshops and presentations and kind of showing the good work we do with our co-production models, with our simulation, and we represent us on the national stage.
I would also like to just finish by talking about the fact that we are very conscious that with the current workforce challenges in the NHS, that medical education have an even more important role than we have ever done before in ensuring that our doctors, our psychiatrists of tomorrow are as well equipped and trained as they can.